Quality sleep is essential to human health, and a lack of it can not only interfere with your daily functions, but it can lead to other health issues. Dr. Rasmus, Medical Director of Idaho Sleep Health and care provider with Saltzer Health, explains sleep apnea and the role it can play in your lack of rest. Dr. Rasmus, why did you decide to become a sleep doctor?
Well, quite frankly, I was a pulmonary and critical care doc initially, and then decided to subspecialize in sleep medicine when I realized that it was a subspecialty where people are cured. People come in with a complaint and we can fix it.
Yeah, you like the solution,
Absolutely.
right? Okay, so how common is snoring, and at what point should somebody be really concerned?
Snoring is exceedingly common. Up to 25% of all adults snore, and snoring is rarely normal. In general, when snoring is associated with symptoms like insomnia, non-restorative sleep, or else perhaps daytime sleepiness or fatigue, then we start to worry that the snoring is disturbing sleep and causing problems.
And what is obstructive sleep apnea?
Obstructive sleep apnea is a disorder where the airway closes at night, generally down in here. The patient goes to sleep, their muscles relax, and the vibrating airway creates a snore. Anything that relaxes the airway tends to make it worse, and it's the repetitive opening and closing of the airway is what is represented by obstructive sleep apnea.
Can this be dangerous?
Absolutely. Obstructive sleep apnea is an independent risk factor for death, and aside from that, it's an independent risk factor for things like high blood pressure, diabetes, heart disease, and strokes. So it becomes increasingly important to treat when we're looking at the big picture and improving, wellness.
So are there any cures or ways to treat this?
Absolutely. Sleep apnea is a very treatable disorder. The majority of the patients are treated by opening up the airway either with a CPAP machine, which functions as an airway stent, and we have examples of some of them here. This would be a travel portable machine, and this would be a standard machine. The patient is attached to a hose and a mask, which provides air pressure to stent open the airway while they're sleeping. The other option that we use quite frequently are mandibular advancement devices or dental splints, which pull the tongue and the jaw forward and help open up the airway. More recently, there are some exciting surgical techniques that are being used and will be available in the Valley sooner rather than later.
Dr. Rasmus, thank you so much for giving me this very valuable information, but where can our viewers go to learn more?
SaltzerHealth.com is a great place for information on all of our services, including our sleep services. And there's also the Healthcare Podcast, where I did a 45-minute podcast a couple of months ago that patients can look up and take a look at.
Excellent. Thank you so much.
Thank you.